Hey, thank you everyone for joining us today. We're very excited to have you back to our Health and Wellness Summit. We have two exciting speakers for you today. First of all, Dr. Lisbeth Roy, and then also we have Jennifer Wright with us. Dr. Roy is the head of a clinic called Doctor's Studio, and Jennifer is the clinical director, and she is a certified nurse practitioner. And their specialty at Doctor's Studio is sexual dysfunction, a topic which concerns very many people and something that we really wanted to cover in this summit. And boy, did we luck out, because we have two people who really know what they're talking about in this arena. So we're very excited to have both of them with us today. So the first question I'm going to ask Dr. Roy is, what are the main factors that contribute to sexual dysfunction?
That's a great question. Thanks for having us on today. We're very excited to share this information because it does affect, in fact, 50% of the adult population. So 50% of men, 50% of women actually have some form of sexual dysfunction. When we're talking about male sexual dysfunction, the primary cause is cardiovascular. And so it can be very subtle. That's the canary in the cave mine, if you will. That's why we believe that every man that has any changes in erection really deserves a functionally minded assessment, because they may not have frank cardiovascular disease, but there is something that's happened that's changed the dynamics of their erection, and therefore it's an opportunity, really. And that's the way we view erectile dysfunction, as a symptom of something underlying. So when I say cardiovascular disease, it can be large vessel disease, as everyone worries about having a heart attack. It can also be microvascular, and microvascular is the primary thing that we see in an early developing erectile dysfunction, and that is the very small vessels. 99% of blood flow to the tissue is done through the microvasculature. So you can have large vessels that are wide open, especially a younger man, for instance, may not see any plaque, certainly no symptoms of cardiovascular disease. But when the erection changes, it can be microvascular. And it's very hard to determine the status of the microvasculature unless you have a very special device called GlycoCheck, which, to my knowledge, we are one of just a few practices in the country that have this type of device.
Very interesting. Very interesting. Because I remember I took this product one time called Pro-Arginine, which has arginine in it. Right. And what that does is clears the blood vessels. And I definitely noticed the difference in function sexually when I took that product. So does that make sense?
It does. It doesn't clear the blood vessels. What it does is it provides the body the raw material to make nitric oxide, which is the strongest dilator of the blood vessels. So there's a lot to this. So there's either blood vessel problems themselves, where the density of the vessels can even decrease. COVID-19 is a real player in the cause of erectile dysfunction. In fact, we've done several articles on that.
Really?
Yep. We'll, I'm certain that there's a blog post on our website, because COVID-19 is actually a blood vessel disease. 100% blood vessel disease. That's where the virus actually affects the vessels. So the Pro-Arginine that you took just simply is helping to open up the vessels. So if you have blood vessel dysfunction, you can have a decrease in density, you can have a decrease in functionality. The Pro-Arginine just kind of kicks the dead horse, if you will, right? For lack of a better analogy.
Right.
Wakes things up. But there's a lot to this. And then, of course, you can have a problem with pelvic bowl dysfunction. So the signal for an erection, and certainly we'll talk about women as well, but the signal for an erection starts in the brain. So there has to be appropriate dopamine. There has to be appropriate neurotransmitters. Then it has to travel down the spinal cord through the pelvic bowl and then stimulate the vessels that dilate, that feed the penis. So there's a lot that can happen from the brain all the way to the penis. And we look at lower back issues. You often will find lower back issues associated with erectile changes, pelvic bowl dysfunction. And, that's the real injustice, I think, that is happening out there, that there's missed opportunity to really identify what are these underlying issues that are brewing and sometimes life-threatening. Instead, we're buying medication online, we're buying supplements, we're doing things to treat the symptom, which is wonderful in the short term, but in the long term really deserves a better.
Yeah,
I would like to.
Yeah, go ahead, Jennifer.
But I'm sure you probably assume Dr. Roy would be mentioning something about testosterone, because men usually associate their dysfunction with a low testosterone. Right. And I think what really makes us stand out and excel in sexual wellness is that we know there is so much more. Just by getting somebody's testosterone level up, it's kind of like putting the icing on the cake. It's not really, that's not going to fix the underlying cause. And because we do get down and we fix really what's actually causing the dysfunction, like Dr. Roy said, we've found men who have cardiovascular disease who came in who didn't even know they had cardiovascular disease, but they had changes in their erections. So that, I truly believe, is what makes us stand out from all the rest. We get down and we really understand what this means in the human body.
So let me ask, what if it's heart disease or the small capillaries and the small pathways that are being stuck, what kind of treatments do you do to fix that?
Well, foundational, right? So lifestyle changes, for instance, very specific lifestyle change.
Could be diet?
Absolutely.
Majorly diet. Yeah.
I mean, diet's 90, you are what you eat, right? And the way that you function is going to reflect that, period. And there is no medication that's going to be able to overcome that. But there's so much misinformation out there regarding proper diet, and proper diet is an individual thing. So what's proper for Jennifer may not really be proper for me. There's food sensitivities, there's inflammatory issues that are in part genetic, that if you understand that, you can advise ways to optimize function. You have to really understand something significant about how the body works, and then understand the ways in which it becomes dysfunctional in order to take someone back through that dysfunction back to full optimal health. Right. And they will realize changes from head to toe once we start engaging with them. I had mentioned before we got started here that our website is in a redesign, and certainly we have the male sexual dysfunction up there because that's what we're best known for. But there's so much behind that. There's so many things that we do to help to revitalize and regenerate that sexual function and that sexual potential, that it really is a full head to toe evaluation and approach.
And truly personalized medicine. We are delivering personalized care to each and every individual. There is no one size fits all. There are some things that we can follow in order of, a test and a procedure or a dietary change, but we make sure that we really look at each individual and figure out what's going to fit them best.
So there's a structure within which we work, but we customize according to what it is that we find. And then certainly there are certain treatments and foundational types of supplements that help to rebuild that potential. So for instance, you mentioned proarginine. If your endothelium is dysfunctional, you can throw as much proarginine in the body as you want. It's not going to really work, right? Yeah. It's like making a cake. You leave out one ingredient and it's not going to
taste so good.
It's not going to be the magic.
I'm really glad to hear that you take into account diet and food, because so many medical doctors do not really, they're not trained in it, and so they're not taught it, and so they just leave that out. And obviously it's so important to have the proper diet.
Well, and I'm going to give you a couple of examples because that's the key. Okay, we do not think in the box. There's nothing in the box that is going to actually help to solve these problems. And when I say in the box, I mean your typical traditional medical approach. If that were the case, we wouldn't be in business. So by the time people find their way to us, it's because they haven't been able to be helped elsewhere. They go to the urologist or the cardiologist or their family doctor, or they're buying things online. And either those things are not working, or they're no longer working, or it may be an astute consumer who understands that those things are fine for the short-term symptom control or benefits, which we definitely want to get benefits as quickly as possible. We realize what damage and hardship these kinds of things really do present.
Yeah.
But there's nothing in the box here. It really is a full understanding. I often joke and say we're mechanics. We're human body mechanics. And we not only understand from a biomechanical perspective, but we also understand from a cellular function perspective how all of this happens and why it is that you have to really align everything in order to get your best effect. Men that have reflux disease, for instance, acid reflux. I mean, if you surveyed your friends, probably 50% of them are taking some sort of medication, whether it's daily or at least a couple of times a week. Well, that is a contributing factor to dysfunction of the endothelium. And yet we can buy that stuff over the counter. People are not, in the traditional medical community, our medical model has trained people one ill, one pill. And we haven't really done a good job, even in medical schools at all, in fact, to help providers understand that you have to consider everything.
All right.
When you are trying to help someone achieve maximum wellness, that all of the symptoms are just symptoms, whether it's sexual dysfunction or hypertension or dyslipidemia. You have high cholesterol, you take a pill, and now you no longer have high cholesterol. Well, that's not really true. Maybe your numbers are low, but you haven't actually done anything to address the underlying cause, which contributes. And we love sexual dysfunction because, number one, it's a systemic result of a systemic imbalance. It's different for every person. And also it's the thing that gets people to the doctor. So we look at it as a huge opportunity to address their wellness. And they may never have actually crossed into this type of an approach otherwise.
Yeah, exactly. Yeah.
Also, what I love as well is that our clients, our patients, they really do have to invest their own effort and their own time. It's not like we can just write for something and very quickly, here you go, here's a quick answer. They are actually investing in their wellness.
It's rewarding.
Yields a much better outcome. And it's very rewarding to see somebody who walks in who has really severe dysfunction. And in 90 days, after cleaning up their diet, following a couple of supplements, really doing, getting back and exercising again, and really getting control of their life, lo and behold, their sexual function is now fantastic, because not only are the mechanics improved, but also their brain, because a lot of what goes on in your brain is made in your gut. So we've cleaned all of this stuff up, and it's a really amazing transformation.
But not only is their sexual dysfunction better, now they're sleeping better. Now they have more energy, and that swelling that they were experiencing, the tight muscles, the exercise recovery problems, they're all gone. And so it really is it's a wonderful way to approach this. It's really is an injustice. I'm going to keep saying that word because we have to help people become aware that there are so many sexual medicine experts out there now, and there's very little regarding expertise that is going into the mix. There's a tool, there's PRP, there's a shockwave device, and suddenly you have an expert. And that's not any better than just, the primary doctor or urologist writing for Viagra and some of these medications. You've just to wash the car doesn't necessarily, it might look better, right? But it doesn't, even if you detail it, it might look
it's not functioning better, really. It's not affecting the operation.
Covering up that underlying cause. You absolutely can make a difference with some of those tools, but unless you address this foundationally, that person is going to be right back where they were in the very near future, and they're going to be further progressed in the direction of disease and not wellness. So
I was going to ask you, because I think a lot of people are seeing the advertising. Like there was just something recently on Shark Tank, where they had a product that was herbal, to Viagra supplement that is not over the counter, that supposedly is phenomenal. So are there herbs that are positive and have a good effect that you use, or is that just hype?
No, it's not hype in that, again, you can push things in the desired direction with a supplement, with a shockwave device, with the pro-arginine. You can throw a little raw material in and you might get a bit of a response. You might throw some testosterone in there and see a little bit of a change. But it's not the underlying issue.
Okay.
It's not addressing the underlying issue. It's symptom control. And though we're not against symptom control at all, or enhancing with some of these things, it's a very short solution and not a real solution. It just,
Right. So what for our clients, when they come in, we do address the immediate concerns. So while we are cleaning them up and putting them through the actual wellness kind of type of treatment, we also do deliver very high quality PRP, have them on some very targeted supplements so that they do start to see more immediate type of improvements, so they don't get discouraged, and then we're able to build on that even better.
Yeah. And did you know that 30% of men do not respond to things like Viagra, Cialis, Levitra? I mean, they don't work. They don't work for them, 30% of men. And the reason is because the endothelium is so dysfunctional that, and it doesn't necessarily mean that their erections are, that they're severe in erectile dysfunction. It means that the body's ability to receive the mechanism by which that medication works, is gone. It's not there. And so same thing with herbs and things, it's got to be part of a real comprehensive program. And the other thing that I think is important is, again, where there is a strong need, where this is a cash type of service that's, insurance doesn't pay for these kind of things, you will get a lot of gimmicks and you will get a lot of people who are experts because they have a device. But even some of these devices are not powerful enough. For instance, shockwave is one of the most exciting things in our field, and not all shockwave devices are created equal. And even the providers running these shockwave devices are often not aware. They're buying from a salesperson. So PRP, same thing. Not all PRP is created equal. So I think the consumer has to be educated, not only that sexual dysfunction could be a symptom of some life-threatening illness that's developing, but also that the solution needs to be comprehensive and that they really need to do their due diligence with where it is that they engage in their care. There are a lot of good quality places out there, so we're certainly not the only, but I really would like to make that a major point.
Well, your focus seems to be the whole person, making the whole.
It's a whole body problem.
The whole body.
So if you're having problems with blood flow to your penis, guess what? You're having problems with blood flow to your brain also.
Right.
You just may not realize it because, to get and maintain an erection is a very dynamic process and there is a lot to it. And so you can absolutely see changes even when they're subtle, where you may not see changes in your cognition or your concentration, or you might think, well, these are normal aging types of changes. Right. I don't remember things as well, but you're connected. It's all connected. And certainly we haven't even talked about women at this point.
I saw in your testimonials patients talking about HRT. What's HRT?
HRT is just hormone replacement therapy. That's all that means.
I see. Okay.
Yeah.
I think we should get some equal time to the female sexual wellness, though.
Yeah.
Because
Yes,
we really
yes.
have changed a lot of women's lives as well.
Yes.
Yeah.
With the
Women
same
are
type
actually
of,
much easier to fix than men.
yeah.
And here's the thing, and thank you, Jennifer, it's true. You know, there are 26, I believe, last I looked, FDA approved medications for men. And there's one, and it's not a great one, for women. And so women, they engage with their OBGYNs or their primary doctors, and they are told, I'm sorry, there's nothing we can do for you.
Really?
Whether it's pain with intercourse or low libido or dryness or, you know, difficulty with orgasm or whatever the case is. Yeah. And that just couldn't be further from the truth. Women are so much easier.
The incontinence issue.
Yeah. And,
Yeah.
and even, you know, urinary leakage, right? For men and women, but 43% of women over the age of 40 actually have a problem where it interferes with their daily activity. How's that? And we know this is true because you can see diaper commercials on television, right? For middle-aged men and women dancing in the streets. I mean, when I first saw that, I thought, wow, that's unacceptable because it's very fixable when you're outside of the box, if you will.
That leads to the question of sexual function for people who are aging. I mean, at what age do you think people should still be able to function sexually?
Until they're 6 feet under.
Yeah, exactly.
So
I mean,
even people in their 90s?
Yes.
Why not?
Yeah.
Why not? I mean, you can be healthy, right? We have men in their 80s that they're unstoppable.
They are.
This is very encouraging.
To be reckoned with.
Well, and I have to say, my hat goes off to them because this has been a focus for them, obviously. And I don't mean that sex is their only focus, but their wellness has been a focus for them. And they've been willing to make the investment in their wellness. And therefore, they have excellent function. They have great brain function. They have great erections as well. And the same thing with women. I mean, we have women that can't keep up with their men, and we have men that can't keep up with their women. And it's a really nice problem to have.
The great
Yeah.
referral source.
Yeah. Well, I think it keeps people living longer. I mean, you know, if
Absolutely.
that's a big thing of mine. I think we should be able to live to well over 100.
That's right.
And live.
And
really
live, and yeah, not just be existing,
That's right.
but actually living wonderful, healthy, you know, active lives. And,
Well,
you know, there's plenty of examples of it.
it's absolutely doable, but it is a commitment, right? I mean, we started off the conversation by just acknowledging that 50% of adult men and 50% of adult women have sexual dysfunction. And so clearly we're not taking care of ourselves, right? So
what percentage of it do you think might be environmental? You know, because I hear, you know, people say, well, it's, you know, it's because of 5G, or it's because of Roundup Ready, or it's fluoride in the water. I mean, what do you think that there's anything to that? Some of these environmental?
absolutely,
Yes.
absolutely. How could there not? I mean, we are a living organism that is absolutely affected by all of those things, those toxins in our environment. In fact, there's only 2 triggers of any disease. And we treat erectile dysfunction as a disease, right? It's a symptom of an underlying disease. And so those 2 things are toxins and pathogens. Okay, so pathogens being viruses, bacteria, fungi, right? Different molds. Toxins being certainly all of the things that you mentioned, including processed foods, right? Stress could be considered a toxin.
The air we
There's a
breathe.
lot.
The air, the GMOs, all of that. Yeah. I'm so glad to hear you say that. That's why I just threw that out there. I was really looking to see what you would say, because, you know, I think that is definitely a factor in all realms of health right now.
It's really undeniable. It's absolutely undeniable. Yeah.
Yeah. One of our other speakers that we have is Jeffrey Smith, who was the guy who wrote Seeds of Deception and Genetic Roulette. And now he's talking a lot about gene editing and the unrestricted, unregulated ability to edit genes. You can buy test kits online now for $165 and edit your own genes.
Wow.
I mean, crazy stuff, you know, that we're allowing to spread out there that could affect the whole biosphere.
Yeah, well, you know, just a little bit off topic, but not quite total left turn, but male infertility has now equaled female infertility. And it is, both are on the rise, big time. Well, is that environmental? Of course it is. Of course it is. I mean, you know, it's absolutely undeniable. So we are at a crossroads, I believe, where we can decide that we're going to take personal responsibility. You know, we can't change everything and everyone, but we can take personal responsibility, and we can make the investment in our own wellness. And sex is a very important part of being human. It's a very important part of what keeps your family together, what is, you know, keeps your self-esteem, right? Your relationships. It's I don't care if you're a nun or a monk, you really, to have good sexual function is important to being human. And certainly when you're in a relationship, it's very important. There are studies, lots of studies that show you live longer if you're having sex. You know, there's much less depression and anxiety. Relationships last longer. Earning, you have a higher earning potential actually, because you feel more confident and you
more vital. You have the energy and the vitality.
That's right.
And the desire.
Yeah, and the self-worth, right? Yeah. I mean, what is it to a man who can't get an erection? Yeah. The self-worth just boom, and it's a big problem. So when you're at the golf course and you're looking around, 50% of those guys are having a hard time, and it's a lot of energy to try to hide that, you know, and to try to compensate. And we know that at any age you can turn into it and really make major changes in your state of wellness, and certainly that translates, especially with so many great tools.
That's a very encouraging message, you know, for anybody that's listening to hear that it doesn't matter how old you are. There, you know, if you can come in and get this evaluated and get your evaluation and get everything back on track and follow the program that you have.
That's right.
They can fix this and get their life back and their vitality back, and relationships back. And
they have to be willing. They have to be willing to make changes. We don't work with just everyone, of course. You know, if someone comes in and they just think that we can do 6 shockwave treatments and prescribe a medication that's going to fix the problem, that's not who we're interested in working with. That's not realistic. We tell the truth, we're transparent, and we want a real partnership with that client. And that's why before we came on, you talked about our Google reviews. Yeah, I'm not interested in failures, right? We're not going to quit. We're not going to fail you, but you may fail to really fully engage. In which case,
we do sometimes have those difficult conversations. There's times where I find that I want something more than my client does.
Right.
And because I know we are right there, I know we have the tools to make these changes, but there are times where you're just trying to, you know, reel them in a little bit, because you know that what you have is just really, really beneficial.
I know exactly what you're saying. My wife and I became teachers of transcendental meditation when we were just out of college, and we taught TM full time for about 5 years. And yeah, it was great. And, you know, we wanted everybody to meditate and enjoy that benefit, you know, that deep rest, because we saw the changes it made in people, you know. And, you know, we wanted every single person who came to our lectures to start, and we'd like, somebody's going to walk out of here and they're not going to start? What the heck? You know, why would they do that, you know? So I know exactly what you're talking about, you know.
Absolutely.
Yeah. It's great to be able to be in a position like that, isn't it? Where you can help people, you know, you have the knowledge.
Absolutely. We work very hard at it, and it's an ongoing process of discovery, you know, looking deep at that cellular level and finding something that makes all the difference in the world. And then you change your protocol. So
right.
it really is ongoing.
we recently started really diving into prostate health as well, because we're finding more and more and more how much the prostate, well, we knew how it was linked to sexual dysfunction, but truly like how we can dig even deeper and understand, I think it's 90 something percent of men have BPH. Well, we do a very specific test here that we can look to see what's actually sitting on the prostate. And then by doing that, we're able to identify things like HPV. Now, HPV is a cause of cervical cancer, and throat cancer, and oral cancer. So it's pretty easy to deduct that if you have HPV sitting on your prostate, we need to get that off.
Right.
And then we have treatments for
What's
that
HPV?
as well.
Human papillomavirus. Yeah, it's the only known cause. Human papillomavirus is the only reason why a woman gets a pap smear every year, is to detect if there's human papillomavirus. And yet we know HPV also causes prostate cancer. There's been several papers written recently, yet no one tests for it. We do, we test for it. We are absolutely want to be proactive. I mean, what man isn't worried about prostate cancer, right? And as Jennifer said, benign prostatic hypertrophy or an enlarged prostate is, again, 50% of those guys you're playing golf with are up multiple times.
By the time they're in their 80s, it's like 90%. It's a really high number.
Yeah, I'm in my 70s, and I know that, a lot of my friends have had problems with prostate cancer.
And they may actually have been, well, not may, they were brewing that prostate cancer decades before they got it. And so we actually test for it. We do almost like you would a woman pap smear. We do an express prostatic secretion, which is just a very simple urine test that tells us definitively what's in the prostate. We find parasites and fungus and bacteria and viruses in the prostate, and then we treat it. But you don't treat it with an oral antibiotic like a urologist would. You treat it in a very special way. So there's a lot to this, and we love taking care of men in particular because they just seem to not get this kind of attention elsewhere. That's just part of being a man, right? You've got to get up to urinate multiple times a night. Things change with your erections. Women, we love taking care of women because though they try and engage with the medical community doesn't seem to have much to help them with. So, it's hard being at that head of that curve, if you will, or at the front of that wave, because it's a lot of education. So thank you for having this summit and providing us an opportunity to help people understand that these solutions are available to them. Otherwise, there's so much noise out there that it's very difficult to tell the truth. And the other thing that's difficult is Google, Facebook, all of these things. They won't let us talk about these things. They won't let us advertise these things. Yeah, no, unless, there's a lot happening these days, of course, but unless it is an FDA approved indication, you can't. It's very difficult in the medical space. So the same old, the perpetuation of, all of this in the box type of pharmaceutical focused medicine it just continues. And most people don't realize how tricky it is to get the message out there.
Most people don't realize how locked in this thing is and how controlled by corporations all this stuff is.
Yeah,
the pharmaceutical corporations, the FDA, the CDC, they're really, those regulatory organizations have been totally captured. They're the law of capture. They're even more than captured. They're like part of the corporation. I've studied that pretty closely, and you're just not going to get anything that's anywhere objective coming out of there. It's going to be heavily in favor of the typical, go by the book pharmaceutical medical industrial complex is what I call it.
It's true, and most physicians and nurse practitioners, providers are unfortunately nervous to get out of line. Okay, and so they're pressured. There's a lot of that. I really don't care. I don't care what my counterparts are doing elsewhere. I'm not focused on anyone except for our clients, and so we work for our patients. That's it. We don't work for anybody else. Nobody tells us what to do. We don't ask permission. we basically have an open and transparent conversation about what's possible.
Mhm.
And you know, we march on.
And you'll have to find other ways to get your truth out other than Facebook and Google and etc. Because if they're, you know, limiting what you can say, you just have to find other ways. And fortunately,
Right.
there are, every day, there are more ways to get that out there because people are realizing that, you know, how controlled the information flow is in this country.
We built this practice through referrals. Our patients
Yeah.
would keep us busy with
Right.
referrals and people
Right.
that they love. And that's, you know, fortunately. But that's really one of the reasons for the website redesign also is just saying, okay, we're growing. We are certainly serve a significant purpose. We are essential. And so we need to do a better job helping people find us and to hear about those opportunities.
Well, let me say this because we have to wrap it up here pretty soon for our time limit. But I am way more impressed than I thought I was going to be. I mean, I knew this was going to be an interesting topic, and that you folks were really good at what you did. But I'm just blown away by, you know, how your commitment to true holistic health. I mean, you guys really are. You are what you say you are. You totally are holistic health practitioners. That's what you're trying to do. Is
Our
really
commitment
make
is
the whole person.
Yeah, and I want to rephrase that just a little bit. Our commitment
Sure.
is to true solution.
Yes.
Our commitment is to true wellness. And trust me, if there were a pill that did that, we would prescribe it. There's no judgment against what's out there. It really is making sure that it's comprehensive and that there's a long-term goal. We use all the tools. So yeah, don't mistake you know, our desire and our experience at working outside the box with a disregard for what is in the box. It's just, it's limited. So
Do you find last question on men versus women? What percentage of your practice is men and what percentage is women?
for sexual wellness, probably 80% men, 20% women.
Really? Oh, so
Yeah.
okay. So men aren't finding it a problem to come in. They're willing to come in. Yeah,
Men are very willing to come in, and
that's good.
you know, they love our approach. Most of the way that we are found, and I prefer it to be found, right? So someone has a problem and they're looking and they're doing their due diligence. And that's the best client because they can see what it is that, you know, how it is that we think differently. But people will watch YouTube videos and see us on YouTube. And what they say is, it just, what you said made sense. You know, nobody ever said that before, but it made sense. And I've tried all kinds of other things. So thank goodness for YouTube.
Yeah, exactly. Well, thank you so much. That was, how do people find you? What's the best way to find you and to find out about everything you do?
Probably the best way is to go to drstudio.com.
Okay.
Yeah, that's probably the best. And we'll be building that website out. But for the most part, and in every way that you could possibly get in touch with us is located on that website or Facebook page.
Also, Clyde, I just want to interject. We have clients from all over. They don't have to be in Florida. We have clients from all over the United States, all over the world. So we can do a lot of the groundwork on somebody who's remotely stationed. We get all the stuff we need to get them there. We have frequent Zoom telehealth meetings. And then when they are able to come on into the clinic, we then do some hands-on kind of stuff. So we're not limited to just people who can just get into the office all the time, which I think also makes us stand out from the rest.
That's a very good point. And we've always been that way. So telehealth is not new to us. We have always communicated with them.
Do you have clients that never come in at all?
Yeah, we do. Not for sexual wellness typically, because that takes, typically there's some procedures that are involved. But yes, we actually have people that by law, once a year, we need to lay eyes on them. But that was actually even lifted through this whole COVID thing. Now telehealth is
interesting. I didn't know that. That's very interesting.
Yeah.
Yeah. Wow. Very, very interesting. Now with Zoom, yeah, you can talk to anybody anywhere. You could be treating people in India. if you wanted to, I guess, because
Yeah, the
Yeah.
only challenge overseas is trying to get them certain things, but we do it. We
Yeah,
do
every
it.
country has different rules and regulations.
Right.
Customs and stuff, but certainly outside of Florida, and it's really easy within the United States. And people will fly in for some procedures, come to Dr. Studio as the workshop, if you will, and then we engage with them.
Do you have online workshops for people to come in and view?
No, not yet. I mean, we do have a couple of digital courses. Our Studio Detox is digital. We have a Studio Lean program, which is a weight loss. Again, they're all sneak attack wellness. You have to wrap it in a way that someone's going to see themselves. So the weight loss program, yes, you're going to lose some weight, but you're also going to raise your level of wellness. So we have started doing that. We are in process of developing a sexual health course, because it's what we talk about every day. And so we're making videos and putting that kind of stuff together. By workshop, what I meant was they come in and we use the tools that we have at the clinic to, to do the job.
Interesting. So
We're mechanics.
So drstudio.com is the best way to find out about you. And wow, I'm just so impressed. I mean, you two are amazing, and what you're doing there. Yeah, I mean, it's so needed, and I'm glad you mentioned the environmental things, because I was wanting to see what you would say. I think that we are experiencing a lot of environmental impacts that are creating a lot of this dysfunction in every area, but sexual dysfunction for sure.
Right, because it really is the canary.
Yeah.
In the cave, yeah. It's
Exactly.
The loaded gun, as we say. It's the loaded gun.
Yeah, yeah. Excellent. I like that analogy. Very good. Well, thank you so much, both of you. I really enjoyed this, and thank you everyone for coming today. And definitely check out drstudio.com. And like you said, over 50% of people, probably have this problem, and should be doing something about it.
And the other 50% just want better sex. So
that's the other part I was going to say. We also can make your sex life that much better. You don't have to have dysfunction to come in.
Be proactive. You don't need to wait until you have a problem in order to be able to really raise your level of wellness. And so we joke about the other 50%, but it's true. The more proactive you are in your wellness, the more you're going to be able to avoid these challenges in the future.
So it's for everybody.
Absolutely.
Everybody hear that?
Wellness is for everybody. How could that not be for everybody?
That's right. Thank you so much. It was wonderful. Thank you everybody for being on today.